Okay, greetings from the Manila Central University. I'm Dr. Maria Lilybeth Tanchoco, the Dean of the College of Medicine of MCU. I'm here to tell you something about MCU and how we deal with our students. MCU has been in existence for more than 100 years, and the College of Medicine in particular is celebrating its 70th founding anniversary this year. Actually, we have already graduated thousands of students who have been very successful in their career. They are all over the world, not only in the Philippines, but in the different part of Asia and America. I would say that they have been really excelling in the field that they are into. Some have been not only in clinical practice, but also into the government, in the politics, as hospital administrators, and many have their own hospitals in which they are now the medical directors. Some also were involved in researches. Some were have very good researches that has been acknowledged not only locally but also internationally as well. Some have been into other businesses as well that has to do with education thing. Now, what we have been doing now in the last few years, we have extended our services and our commitment to students not only among Filipinos but also in the international market. In fact, we have been receiving students coming from the different parts of Asia and also in Nepal and in India. We also have students coming from the Middle East and also from America. Because of the process of globalization, the thrust of the institution is now to really have graduates who will be prepared for the global market. What we did in the last 2 years, we had a partnership with IIRMA Education Consultancy. They are the ones who provide us with the students who have this access, especially in India and in other countries. So they have introduced our college in that particular country, and right now we have several students who are already enrolled in the BS Biology, and some already has started for this academic year for the College of Medicine. So what I'm saying now is that we have opened our market to the global market, and that we have been promoting and introducing our curriculum, which is the outcome-based education, so that we can prepare our students what the industry really needs. Some of the admission requirements that we will be needing, of course, are the student should be able to pass the NMAT, that is the National Medical Admission Test. Even if you're a foreign student, you can qualify for this, and of course, you should have graduated from the BS Biology class before entering the College of Medicine. Other than that, we have facilitated on how you can be accommodated as far as the language is concerned. Our country, the Philippines, has almost the same season or climate just like in India. So the disease that are the people are exposed to are common among both nations. What about the culture? The culture is maybe not really the same, but it's easy to adjust with. And the Filipinos are also very friendly, that they have really gained, our foreign students has gained friends with most of them. Now, the thing here that we want to emphasize is the partnership that we have with the IIRMA, because they are the ones who really take care of the students. They're like families, members of the families. So that's why even if the parents are not around, even if you're in a foreign country, you will not really feel very sad, or you will not really feel that much homesick, because they have provided the home that they will be needing. And aside from that, of course, the faculties and the administration of the Manila Central University is working hand in hand with the IIRMA Education, so that we'll make sure that what the students need are really addressed into. So I hope you will consider the MCU College of Medicine, because it's not only in BS Biology, but we have been preparing our students also for foreign medical examinations such as the USMLE. In fact, every year we have the comprehensive examination, which handles both the basic on the first and second year, and then on the clinical subjects on the third and the fourth year, so that our students can be able to take all those examinations. The MCU College of Medicine, in fact, is one of the accredited institutions of the ECFMG. That's why, as far as qualification is concerned, then there will be no problem about that. I just don't have the exact figures, but we have a lot of students who has passed the USMLE and who are now having their training, and some were even practicing in the United States of America. And this is a very good stepping stone wherein you can pursue this career, not only, of course, to have training, but also to help your fellow people, not only in US, in other countries, but especially in your own country, where you will be expected also to come back and help in the health situation of our people. I think that's all, and I just hope, what else? I forgot to mention, with the basic subjects like anatomy, what is special about the college? We deal with real life human cadavers, no? So that it will really simulate the real human anatomy, so that what will happen is that you'll not have a hard time. So it's not just a simulation models, but just as anyone else, before we deal with live human beings, we also have simulation models that we can really learn from, so that when we encounter real life people, then we will be ready for that. So that is how we prepare our students. We also have community works, no, wherein the students are not only in the hospital situation be exposed to, but they are also exposed to the community, where they learn community organizing. So this is one thing that we need to address nowadays, because most of our students before who have graduated has the knowledge and the skills on how to handle patients in hospital situations, but not when they are in the community. So what we are dealing now is really expose our students for community organizing, for family histories, deal with how the family can manage their own, so that, because it's the prevention of the disease that we are after and not just the treatment. So that is why we have really encompassed everything. We have graduates who will be primary healthcare physicians. And this is not just a local thrust. In fact, this is a global thrust, and this is the thrust from the World Health Organization. That is the mandate now, that all those who graduate from the medicine class should be a primary healthcare physician, meaning these students who have graduated should be able to be on their own and be able to manage all the basic needs of what individual health should be needing. And this has already been addressed by our curriculum as well. And I am very proud to tell you that all our graduates can really excel on this part, and it will not be a problem at all. With regards to board performance, I'm also proud to inform you that we had several years when we had a 100% board passing rate. On the average in the last 5 years, we have more than 90% board performance rate. And that is the only quantitative parameter wherein we can measure the success of every institution. So I hope you will really consider and be a part of the Manila Central University family, having the IIRMA Education as our partner. Thank you.